Hello, I'm Dr. Sindhu, one of treating. Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name and age, please? Nice to meet you, Mr. Ali. May I know what brings you here today? Okay. Anything else? Okay. I'm really sorry to hear about it, Mr. Ali, and I totally understand that being a parent, how a stressful situation would be for you. Mr. Ali, can you tell me if your child is accompanying you? What is his age and his name? Okay, Mr. Ali, is there anything else you want to add? Okay, I really appreciate your concerns, Mr. Ali, and let me explain why your child needs insulin injections. Actually, diabetes is of two types, type 1 and type 2. Okay, and type 1 occurs in young children as your son is. Okay, and in young children, sometimes one of a body organ called pancreas does not produce a chemical called insulin. And absolutely, the insulin is not available in tablet form, so we have to replace that chemical insulin by injection from outside. Okay, are you following me, Mr. Ali? Should I proceed further? Okay, and in type 2 diabetes, that occurs in adults, and their organ pancreas is able to produce some amount of insulin, and its functioning can be improved by taking certain tablets. So the adults can take tablets, but children need insulin injection for lifelong. Are you getting me, Mr. Ali? You know, Mr. Ali, we are lucky that we are living in an era in which a man-made insulin available, and previously insulin was not available in type 1 children. With due apology, used to die before adulthood in about 6 months' time. So we are, in such era that insulin is available. Okay, is there anything else? Okay. Yes, Mr. Ali, these injections are not painful because they are given by a very small needle, and the needle prick is nothing more than a bite by a mosquito. Okay, and bring your child in the next appointment with you, so that I can give this needle injection to myself in front of your child to remove the fear before it is given to him. Okay, is it okay with you? Are you following me? Okay. Okay, Mr. Ali. Yes, actually, these days very small needles are available, and these needles are not only small but very thin as well. So prick is only skin deep and not painful. Okay. No, Mr. Ali. These days we do not use syringe and bottles, and your insulin pen are available in which filling of the exact dose of the insulin is not difficult, and very small thin needle is there, which can be replaced after every injection. Is it clear till now? Okay. Okay, I totally understand your concerns, Mr. Ali. And yes, Mr. Ali, with proper diet and proper dose of the insulin, chances of lower sugar attack can be minimized. And we can check the blood sugar frequently to prevent low sugar attacks, like if your child was just before the sports or after doing exercises. Okay. And also just before the diet is taken and 2 hours after the diet is taken. Is it clear? Okay. No, Mr. Ali, a special kind of diet is recommended. Your child can eat a normal healthy food as other people eat, except he has to avoid simple sugar and sweet things. Is it clear till now? Okay. Yes, your child can play any game he likes. The only precaution is to monitor his blood sugar before and after the sports is played. Okay. and some sweet things can be given before sport is started, and some sugary material like ordinary sugar, regular Coca-Cola, chocolate, or some sweet biscuits can be made available at hand. Okay, if it makes sense to you. Okay, is there anything else? Okay. Yes, Mr. Lee, your child can have a normal life expectancy as any other child if he keeps his sugar well controlled, okay? And the complication of kidney, eye, and nerves can be delayed for decades if blood sugar is kept in normal range, okay? If it makes sense to you? Okay. Yes. Yes, Mr. Lee, let me share a good news to you that insulin-producing pharmaceutical companies a few years back gave medals to those type 1 diabetic veterans who completed their 80 years of life while being on insulin injections. And so, if it makes sense to you, like they lived, they got award in their 80s. So you can imagine the life expectancy. Okay, is it clear till now? Okay, Mr. Lee. Yes, Mr. Lee. Yes, insulin can cause increase in weight only if insulin is given in dose more than required. Okay, otherwise it won't. Okay. 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 Yes, Mr. Lee. Let me alert you about the signs of hypoglycemia. Yes, the signs of hypoglycemia include sudden desire of hunger, drinking sweats, tremor in hands, and you can notice a gait problem like a drunken person, and a fast heartbeat and drowsiness, headache can occur. Okay, if you think like these things, if you see these things in a child, God forbid, then you should give a glucagon injection. Okay, it is glucagon injection can be given intramuscularly in buttocks. Okay, and person regain consciousness within 5 to 15 minutes. Okay, and but one need to learn how to give glucagon injection beforehand. Okay, and all family members and colleagues at like at a school should be taught if a glucagon injection is not available. Then a 20 cc of 25% glucose ampule can be given intravenously. Okay, if it makes sense to you. Okay. Yes, Mr. Lee, make sure that your child keeps wearing a Medi Alert bracelet or necklace describing your child as a diabetic, okay, so that in emergency situation, God forbid, okay, so that he can be given to appropriate place to, he can be taken to appropriate place to help, okay. Is everything clear till now? Okay. Should I repeat everything again for you? Okay, so firstly we talk about the type of diabetes, okay, and about the need of insulin, okay, and when to check sugar and precautions, okay, and then we talked about life expectancy, okay, and then we talked about hypoglycemic sign and symptoms, okay, and lastly we talked about how to